Good morning, everyone. I'm Nour Marshaha, Prosthodontic Resident R2 at Riyadh Alam University. I'm here today to present my topic with my supervisor, Dr. Mohammed Rafi, the Dean of the College of Dentistry, in a title of Shade Selection for Indirect Anterior Restoration. We're going to talk why I chose this topic. Because of the difficulty of matching shade and translucency in restorations of different thickness, so the situation becomes more challenging when a veneer restoration has to be fabricated next to anterior crown. Okay? And now we're going to talk about the introduction, guidelines for shade taking, and factors to consider, challenges, management, clinical case, take-home message, and references. For the introduction, we'll start it with, and the pure smile has been always the request of many patients. Shade selection is demanding task even for the most experienced clinician. The shade of the core of the crown should be the same shade of the adjacent teeth, and the final color of the all ceramic restoration is emerging of the underlying tooth structure of core and the ceramic material. So, shade taking can be performed by using diverse methods, including tooth shade guides, digital cameras, colorimeters, spectrophotometers, and intraoral scanners. There's three fundamental to have a color factors that is necessary: the light sources and the object, also the observer. And there is also elements for the color. The dentin considered the primary source of color, and there's another elements too, like hue, value, chroma, translucency, opacity, light transmission, scattering, metamerism, and fluorescence. So, the appearance of teeth is mostly determined by how light interacts with the surface. Several factors affect the final color of the restoration, like the shade of the stump or substrate, the thickness of the laryng porcelain, the number of firing cycles, luting cement, and now we're gonna know more about the thickness of ceramic materials. It was restricted by amount of tooth structure, but clinicians should take care to achieve a good color matching for ceramic veneers because of the thickness limitation and high translucency of the materials of the restorations. Communicate information to our laboratory have also greatly improved by learning language of color and light characteristics. We have to do also try and paste by the resin cement system to evaluate the color matching of restoration. And now we're going to see the guidelines for shade taking for crowns and veneers. When we have a crown adjacent to veneers, we have to know the specific points related to crowns and veneers, like if the crown is implant or tooth sound or discoloration tooth structure. We have to know the tooth preparation of the veneers and substrate of the color, the preparation of the crown, the materials, the cementation that we have to use, also the sump shade and lab technician. Matching the veneers and the crown in the aesthetic zone is one of the most great challenge, okay, in this point, because especially in the anterior teeth. Kittel said that core translucency, one of the primary factors that governs the aesthetic as optical properties of all ceramic restorations. So, lithium disilicate provides a distinct advantage in translucency over opaque zirconia. If it's sound tooth or endodontically tooth, we have to know the stump shade and the core that we have to use for the crown. Ceramic thickness and background type affected the color match. The restoration thickness depends on the amount of tooth core reduction. The background is related to the tooth core foundation. To match both restorations, a screw-retained implant crown is a restoration of choice to allow shade matching of the zirconia attachment to the color of the prepared veneer attachment tooth. Increasing the ceramic thickness in order to gain opacity requires over reduction of tooth structure or the fabrication of bulky restoration. We can see here the material and the CAD-CAM that we use at dental clinic when the apparent color difference after preparation. The design for monolithic restorations should provide a minimum thickness of 1 millimeter on the labial surface to mask any discolorations. We can see here in the Riyadh Al University the CAD-CAM systems that we use. And a minimum zirconia thickness of 1.1 millimeter are essential for color match. New generation of all ceramic systems are adhesive system allow dentists to use minimally invasive approach to make thinner restorations. A thickness between 0.6 millimeter to 1 millimeter is suggested for masking colored backgrounds. And polycrystalline zirconia ceramics may be more challenging than feldspathic and lithium disilicate ceramic in full contour restoration. Dye reported that 1.5 millimeter zirconia thickness is necessary to mask dark and metal background. And also, shaded cements may create undesirable color when using 0.6 millimeter, especially for the high translucency zirconia. Stump shade is selected after preparation are completed. And we have to know that monolithic zirconia represents higher color changes with silvery metal backgrounds than with a coppery metal and tooth shaded background. So stump shade has no effect on all ceramic restorations if we have a thickness more than 2 millimeter or greater. The ceramist verify the stump shade after porcelain firing. Why? To ensure the proper color, chroma, and translucency. We cannot mask stump color if we don't know how to mask what we are masking and where. This is the underlying difference between the beautiful smile and so-so cosmetic results. So now we're going to talk about the veneers of preparation. If it's a prepless or traditional veneers preparation, and increasing the thickness means decrease the translucency of the material. So for the substrate tooth color, we have very limited masking capacity. For the material, lithium disilicate provides advantage over the zirconia ingot. Why? Because we have properties, apical properties, HO for high opacity, medium opacity, low translucency, and high translucency also. For the cement, Try-in cement can be used to evaluate the color matching of veneers. For the stump shade also, we have to send it to dental lab order to let him know the color, and we have to know the shade communication, proper tooth preparation, and ceramic layering techniques that we use. Non-discolored stump shade using as canvas for predictable shade matching for the discolored tooth. And now, the stump shade can save time and money by eliminating reshades and remakes through time. The shade difference between the maxillary center veneer and the crown, even with the opacity correction layer, apply the restoration and low light transmission. It's the dental technician's responsibility to remain educated about the latest materials that we use, techniques, for aesthetic longevity and comfort. Now we're going to talk about the factors to consider. We have many factors related to dentist, environment, materials, patient. If it's related to dentist, we have subdivided two groups: under control the dentist and under control the dentist. The under control the dentist should know about the color science, the timing of shade selection, the positioning also the patient and the operator, and the choice of the shade guide, and also how we can holding the shade tab. The factors under control the dentist also morphological details, surface textures, translucency, topography of tooth, stump shades. Okay, and now when you are going to be a very good dentist in aesthetic, you have to know how to do curving and to check all the cases that it comes from dental lab office before apply the restoration to the final procedure. Now the factors to consider, the tooth surface is also very important factor when we are choosing the color, because the يعني the hue chroma value surface of the texture important aspect to be observed and noted. If a hue and chroma and value are matched to fabricate, the artificial apple will not be good match to be matched unless the surface texture is copied too. So you have to take care of the details of the textures of the surface. So to do this shade selection visit, you have to select the surface texture, determine the value, hue, chroma, and the translucent. You have to determine the contour, labial, and buccal surface. You have to document the established shade and tooth morphology. Don't forget to take photograph and do shade mapping and select the restoration material. This is suggested form for the shade selection. And now the factors related to environment. We have to know the quantity and quality of light, metabolism, contrast and the glare, the furniture, walls, the clothes of the patient, and makeup. Also, we have two methods for detecting the color: visual shade matching and instrumental shade matching. We have limitation for the instrumental shade matching, and it's limited use. The most common shade way matching is the visual shade matching. So patient education also, it's very important, and temporary prosthesis, when we send the patient the temporary prosthesis, and we have to know the background and personality of all our patients. Now the challenges related to knowledge about light science, the tooth appearance, and photographic communication. We have to put a written graphic, okay? And always try to matching the hue and the chroma, and the value is the most important factor. Now, how many words do we need to describe these teeth in the written form? It's much easier to transfer the pictures to dental lab and explain on picture. You will just develop your skills with your partner of dental lab, because the level of communication to lab must be recognized and understood in the photographs. And now we can see that we need digital photography and digital technology tools too. We have to understand how to use the digital smart design by using Keynote, or the software by using PowerPoint, to allow the planning of the possible treatments and communicating with the patient and also the dental lab. The position of the taken picture is also very important in detecting the shade. We have not to allow patient to say yes, maybe, or no. You have to be straightforward to the camera lens while taking the picture. And the positioning for the camera should be exactly 90 degree at the smile. And now we're going to see the management of the color. We know all the Mansell 1898 color order system. The hue is the actual color. The chroma is the saturation of the color, and the value, it's the brightness or darkness of the color. We also can detect the value directly. The value is most important dimension. So we can see that the lateral of 22 is more easily recognized than other teeth, because the small differences in chroma and the hue is not easily recognizable. Now we can see the Vita shade shade guide, how it's started from A1 to D4. That means A is orange, B yellow, C yellow gray, D brown gray. So when we are going to the by the shade guide to D4, that means we increase the chroma. When we are going to the B1, it means lowest chroma and highest value. Translucency is considered the photochromatic dimension, so the amount of light transmitted through the material. We can see the transparency, how the light is transmitted Totally, the translucency, how the light transmitted by gray color and incidence light, it doesn't becomes by the material thickness, that means opacity. And now if we'll take a shade guide, don't dehydrate the tooth, take it before start the preparation and after preparation to take the shade guide, put the stump shade under the tooth, and also the distance of a viewing, it should be 1 millimeter, and for hue and chroma less than 30 centimeter. For the background should be gray, okay, we can use this background contraster. For stump shade preparation, we have to take it to. For the clinical cases, you can see together the clinical cases in my clinic, how we can put the veneer and the crown adjacent together, and how we can easily document it and send it to dental lab office just to know the stump shade, and finally get this fine result and preparation for doing the cementation for this case. And also, you have to take care for the margin because don't try to remove the excess gel by there, because it will make a stain on the margin later on, because it will gonna be rough. So try always to be very gentle while doing cementation and easily clean in a gel phase. And we can see the partial veneers here too. It's very hard to match the color in this case, but we can see the case how it's going to be after detecting the shade and mapping shade by understanding the language of communication of the color between practitioner and dental lab office. So we can see how the result gonna be after try-in, and how the partial veneers look like. And now you can see also another centers of the veneers. Okay, this one for diastema after removing the old restorations for this patient, and this one after try-in. We can see in this video how the value look like. So I try to put neutral shade color cementation just to match the color as much as to the adjacent dentition. And we can see another case too for our colleague related to fluorosis, and how it's going to be after doing 4 anterior veneer with minimal preparation. And also that one for 2 crowns, how we make the color of the teeth the same of the adjacent, and that one the steps of try-in and how it looked like after doing the cementation. Okay, so to do mapping always, it's very important just to know each tooth structure, thickness, and per part. It's very easy to do full mouth rehab than doing 2 or 1 unit. Here we have 1 unit central of this patient, and you have to see in a value, we have to check the picture in white and the black picture just to check the value of the case. We can see here the case after, how we take care of the tooth details, structure, and also the contour. Here also the shade mapping, how to make the translucency at the incisor, and how the cervical gonna be darker. Take home message for you. You have to know that the ability to translate knowledge from brain to brush to mouth is becoming a lost art with advantage in CAD/CAM technology. You have to be more details. More details we have, the better of the patient, the clinician and technician will be when we work as a team to produce the best aesthetic outcome. We have to know that the lithium basilicated crown and veneer restorations offer promise for overcoming many obstacles faced with zirconia. Color mapping is very important to include your vision and texture, translucency, and contours to improve your chances in receiving restorations. So this is my references, and for your questions, I'm waiting your questions in e-learning, and thank you so much for your time.